Okay, thank you very much, Professor Grace, and everybody here. Those we have not met, my name is Madanda Ramazan. I work with K International. And for this particular project, we collaborate with the School of Women and Gender Studies of Makerere University to co-host, as well as, the University of California to support us, in implementing this program that is supported financially by Hewlett Foundation. And I can see, I think almost everyone who is here probably has attended a series of our capacity meetings. And this is the last in the series of the trainings, if I'm correct. We've been going through a number of trainings. This is the fourth. And then just to remind ourselves that we also have thematic discussion groups, which are also ongoing. And we will also close this conference later on, this workshop later on with a conference. And so we'll soon be getting back to all of us to make a contribution. We look forward to this training. And let me probably ask Meredith to introduce the trainer, and we get started in just 1 minute. Thank you very much and welcome.
Thank you, Madanda. Our trainer today is Betsy Kostenbader. She joins us from FHI 360, and she has been very involved in the monitoring and evaluation work that has gone on under the Global Learning Collaborative, which is the global counterpart to this community of practice. And she is an M&E expert, very excited to share with you the last session in our first training series. So Betsy, please take it away. And Camille is driving the slides, so just feel free to let her know when you need them to advance.
Great. Okay. Thanks, Meredith. And it's lovely to meet all of you. Good afternoon. As Meredith said, I am a social scientist at FHI 360, and my passion is kind of thinking about how we monitor and evaluate social norms change to inform our programs. So, so the next slide, please, Camille. So I've been working with, as Meredith said, the Global Learning Collaborative and the Nigeria Learning Collaborative, and in coordination with Ben and his colleagues, we've been doing this capacity building webinar series, and this is the fourth in this series. And I think most or all of you have attended the other three, where you started off with thinking about what the relevance of social norms theory for health promotion interventions. And then you talked about identifying social norms, identifying strategies for norm change. And now in this session, we're going to think about monitoring and evaluation for social norms shifting programs. What is specific or different when you're thinking about monitoring and evaluating for social norm shifting programs? Okay, next slide. So apropos to what, to this topic, we're going to think about when to monitor. Sorry, I'm not seeing the full screen here. Hold on. We're going to think about what to monitor and evaluate for social norms change programs, when to monitor and evaluate for social norms change programs, and then we're going to talk about how to measure, to monitor and evaluate social norms change programs. We're going to do an activity there. We're going to do another group activity, fictional case study, have some key takeaways and additional resources for you all. Okay, so first, a little recap of what you all did in the last webinar. So I, unfortunately, was not able to join you on your last webinar, but I have participated in that webinar before. And next slide. I think some of the key takeaways from that session were to think about that change happens when people see enough other people changing, and that and it takes longer to achieve with social norms because there are these unwritten rules, right? And that there are 4 norm strategies that Ben talked with you about, right? Laws and policies, mass media, normative feedback, and group discussion. These are our four principal norm strategies that we talk about. And sometimes it takes combinations of those to make norms change, right? And the third takeaway from that session was that strategies can be mixed. So the important thing is to choose your primary strategy, who to target, in selecting one or multiple of these change strategies. So here they are again. The laws and policies. I'm not sure what all laws and policies been presented, but we can think about laws and policies that have been passed, you know, on female genital cutting and child marriage, and how those have moved to social norms environment on those issues. Mass media, you know, whether you know, across large communities or societies, using different mass media to change the ideas and the messages around what's proved behavior. It's been shown to be super effective. Personalized normative feedback is more thinking about, you know, giving people individuals the idea, telling them what's normative in their society and kind of correcting their misperceptions about if everyone thinks that everyone else is, you know, drinking heavily at home, and then you provide them with some feedback that says, actually, no, people aren't doing that at home, that might change their perceptions of what the social norm is, and therefore, in turn, their behavior. And then group discussions are often really helpful, right? Because you're trying to change things at a social or community level to get people talking about these issues and supporting each other in, and then people have a better understanding of what others think the norms are, and they shift over time. So that was a recap from last session. And again, I wasn't able to join you all, so I don't know exactly which examples Ben gave, but really quickly, are there any, if we go to the next slide, we'd like to do a little reflection, I guess, for a few minutes from webinar 3. So I want maybe to have you all think in your heads about a health intervention that you've seen or created in the past, and which of the 4 strategies might be most appropriate to be integrated and how. And I'll just give you a few minutes to think about that, and then feel free to, you know, to unmute yourself and or put something in the chat. We'll have a, yes, so the question is, which of the 4 norms change strategies that we just talked about, laws and policies, mass media, personalized normative feedback, or group discussions, might be most appropriate to be integrated into a health intervention that you've seen or that you've worked on, and how might you do that? And there's no wrong answers here. It's just a little to get our brains working and thinking about these strategies. So I'll give you like a minute or so, and then you can feel free to unmute yourself.
Okay.
Yes.
Can I go
Absolutely.
first? Maybe?
Yes, please.
Yeah, I'd actually posted a question somewhere as which of these is most effective. In our work here at CARE, we've used I think mainly, I can see colleagues online, they can dispute what I'm saying if I'm misrepresenting, but I've used mainly a normative level, I mean personalized level, personalized discussions, and also group discussions, you know, or group interventions to try and of course less of the others, although we also go there, but we are more familiar with the lower 2. But I'm wondering which one, is there any evidence that which of these could be more effective or more cost effective for that matter?
Those are big questions. Those are great questions, but big questions. I mean, I think, you know, it depends on what kind of behavioral outcome you're trying to achieve, and at what scale. You know, when we talk about social norms, we're talking about, you know, we could be talking about society. We could be talking about, you know, across a whole country or a whole region, or we could be talking more localized within a community or even within an organization, right? So it depends what scale you're trying to achieve. And it depends what outcome. And so, you know, the examples that I gave a minute ago about laws and policies that have been enacted around, you know, child marriage and female genital cutting, you know, those were trying to achieve change at, you know, at a country kind of level. And so they really needed to provide that support at a very broad level. So, you know, personalized normative feedback may have been more challenging there. That said, I would say that, you know, I think there's quite a bit of literature showing that laws and policies alone are typically that effective, that you need kind of a combination, because you know, people need to feel that that they will get support for following that law or policy at a, so, you know, I think it's hard to say that there's one specific, you know, yeah, I'm seeing some chat here about a combination or cocktail, and I also think that that's kind of where I think the you know, the evidence is that you kind of often need a combination of those things. You know, again, depending on where you're trying, what level of change, what the social group is that you're trying to change, and what the behavior is you're trying to change, and what kind of a budget you have. I mean, you know, as you're saying, most cost effective, you know, mass media can sometimes be more expensive, but then again, you know, it can be effective at diffusing a message more, you know, more broadly across a bigger group more quickly. So, so I think the answer is it depends, but I think it's a great question, and I think we need more evidence out there about what people have, you know, have found to be effective at different social levels for different behaviors. That's a great question. Any other, anyone else want to jump in and suggest maybe a health intervention that you've seen or worked on? Which strategy might be most appropriate? Or again, there's no wrong answers. It's just for us to discuss and think about for a minute. All right, I'll just give you a minute. I'll actually restate the question quickly for those of you, because I see some folks are just joining. The question here is, you know, we're thinking about these 4 different principal strategies that we think about for changing social norms. These are laws and policies, mass media, personalized normative feedback, and group discussions. And the reflection activity here is just for us to be thinking, for you all to think about a health intervention that you are aware of, that you've worked on, that you've seen, and then to think about which of these 4 strategies might be best suited to be incorporated into that program, and how you would do it. Anyone want to venture some thoughts? I see.
Actually, Betsy, about 15 people joined pretty late. So I don't know if you can give them maybe a quick recap, 1 or 2 minutes, so that they can, I don't think they are aware of where we are at right now.
Okay, great. That's helpful. I didn't see how many people had joined. Okay, great. So maybe I'll go back for 1 second. So we were recapping what you all discussed in your last, if you could go back 1 slide, Camille. We were recapping what was discussed in the last, this is a 4 session webinar series. In your last session, which was led by Ben Shislagi, he talked about norms change strategies. And 3 of the key takeaways from what he discussed was that, you know, change happens when people see enough other people changing, and this can take longer to achieve with social norms. That there are 4 principal norm strategies that have been used to change norms. These are laws and policies, mass media, normative feedback, and group discussion. And that strategies that can be used to change norms can be mixed. You can choose your primary target and who to target, and then you can select one or multiple of these change strategies to use. So the next slide, Camille, kind of illustrates what these, a little bit what these are. All right, laws and policies, we're all familiar with what those are. Mass media, you know, are using radio, TV, you know, billboards, et cetera, big campaigns to get across messages. Personalized normative feedback is more thinking about providing to individuals feedback on what others are doing, maybe correcting their misperceptions. Maybe if a lot of people think that everyone is drinking heavily at home, and then you tell them actually people don't drink heavily, it might change their perceptions of what's normative and therefore their behaviors. And group discussions is the idea of getting people together in communities, organizations, etc., to talk about you know, the behaviors and what's normative, and support each other in thinking about changing those norms. So so we were just going to do a quick, and in the interest of time, we'll probably just do this super quickly, but if anyone has, reflection activity was, if you have any, if you can think about a health intervention that you've worked on or seen, and you think about an example of which of these 4 strategies might be most appropriate for that program. Does anyone have a thought? Yes, Grace, I see you raised your hand. Yeah, go ahead.
Yeah, I was going to talk about the keeping girls in school by addressing the issue of menstrual health. And the intervention has been mainly by the civil society, is to provide the disposable sanitary towels. But it didn't work effectively because we needed other interventions. For instance, even the laws and policies. For instance, removing the tax on sanitary towels, which didn't happen. And also it required, you know, another intervention, maybe, you know, talking to parents and others, because now the girls would say they have two pads and then they have nowhere to wash them from. So as we discussed last time in the last training, we saw that that for most of these interventions to succeed or to address a number of these norms, you need a combination of interventions, and a combination of interventions should also be leading to the number. The point, one of the things you was, unless people see a big number of people practicing a different norm, that's when the old norm begins to change. Otherwise, we had examples where people would change at home, but when they go to the community, they still adhere to the old norm. So people must see a number of others behaving in the new norm for them to change. And this is why it is important that you deploy a number of strategies, including mass media that would mobilize the communities, but also personalized and of course also supported by law where possible. So that's one example I can give, because girls continue to drop out of school anyway.
That's a great example. A great example. Menstrual hygiene management is a great example. You kind of need a combination of strategies to most effectively change the norms and ultimately the behaviors around that. Fantastic. Okay, so let's get started on the next slide. Again, for those of you just joining, I am Betsy Kostenbader. I am a social scientist at FHI 360, and my passion is kind of thinking about how we monitor and evaluate social norms change programs. So I'm sure that there's a lot of expertise in this group, you know, and experience with monitoring and evaluating you know, behavior change programs, but I want to try to help us focus today on what's different about monitoring and evaluating social norms change programs, social norms shifting programs. So the next slide. So typically in your when you do your monitoring for your programs, right? You're thinking about, you want to monitor your activities, your strategy and your interventions, and you ultimately want to monitor and evaluate the behavior change that's happening, right? But click again, Camille. But the question is, what we're going to, the elephant in the room is, what do we monitor in between? So if you click again, and the social norms change process is really messy. So are we monitoring this? How do we do this? So the next slide. So again, here are some examples of things that we typically monitor. We typically, example indicators here are, the proportion of the intended audience participating in the intervention activities, changes in individual, and then at the, for the outcome or the behavior change, example indicator might be the changes in individual knowledge, attitudes, and practice. But we need to add in, the elephant in the room, monitoring and evaluating the social norms change process. So next slide. Okay, so this first slide here is to help you think about the fact that when you're thinking about monitoring and evaluating a norms change program, there's a strong likelihood that multiple norms have bearing on your behaviors of interest, right? So, when we think about a behavior, we often assume that the social norm that corresponds most directly to the behavior is the one with the greatest effect, and whether we can change that behavior. So in this particular example, child if the behavior of interest is child vaccination, we'll ask about social norms directly related to how many children are vaccinated, right? Is there a perception among parents that child immunization is common, if that's a common behavior? But in reality, there are likely quite a few indirect norms that may have an impact, a strong impact as well on the outcome, right? So an indirect norm might be that most mothers are responsible for taking children to the clinic, or that most men do not trust Western medicine. Let's see, or that religious leaders oppose vaccination. And these norms may have a strong influence then on whether or not the child your child is vaccinated. So we have to think about that not all of these norms are equally strong, nor are all of them equally amenable to change. So we need to think about which norms that we want to influence and monitor, right? Okay. Next slide, you can skip this one, Camille, in the interest of time. We'll go on to the next one. All right, and then this slide is to illustrate that norms are complex. So when and if you want to monitor norms change, norms aren't changing in isolation, right? There's a lot of things that are happening in a social space, and a lot of other things may also be happening at the same time. Right, so in your program, you want to be thinking about monitoring your normative factors, and we'll talk a little bit more about all of these: your perceived prevalence of the behavior, just the descriptive behavior, the approval of the behavior, the identification of rewards and penalties, the intention to give these rewards and penalties. So these are the normative factors, but you also want to be thinking about the social support and networks in that community, right? Is there what's happening in terms of communication about the behavior, about the social norm? Is there support for that norm and that behavior change? Other contextual factors may have an influence here too, right? What's the political economic situation of the households and community? What's the capacity of the community to absorb social change? And, you've talked about with Ben over the last few sessions, but, the target group or the reference group, what's the decision-making power of these different reference groups? And then who is the gender or the age of the target group that you're trying to shift the norm on? Is it, young girls who don't have as much decision-making power? If so, are you involving the right decision makers in the community to help make those norms change? And then other social change, you want to be thinking about, diffusion, what's going on in terms of how the different norms are being, the changes are being diffused throughout the community, and is there evidence of collective action? Are folks in the community organizing to support these changes? So a lot of things that could be going on that are helpful to monitor and evaluate as well. Okay, so next slide, please. So let's talk about what normative factors to measure to monitor and evaluate your social norms change. So I think that in your previous sessions, you've already touched on these terms. We're going to talk about that we need to think about measuring the descriptive and the injunctive norms. We need some attention to who are the reference groups and what are the outcome expectancies, which is a broad term that we use to refer to the rewards or the penalties that occur for engaging in this social norm. So next slide. So first of all, we're going to think about, you want to be finding out about the descriptive norms. So in red is the behavior that you're interested in this case, are getting children getting immunized. And then you want to, this is your others in the community is your reference group here, and then is the proportion of respondents. So you're going to want to be finding out about perceptions of what others do. The proportion of respondents who perceive others in the community are getting their children immunized. And if you click again, Camille, and then this is juxtaposed against the injunctive norm, or the proportion of respondents who perceive that others in the community approve of getting their children immunized. And then you click again. So, and this is to show that you can, it's kind of a formula here for finding out about, thinking about, your indicators for your descriptive and your injunctive norms. And by changing, the behavior here, in this case, you could do the same thing and find out about the descriptive and injunctive norms for getting tested for HIV as your behavior of interest. So again, descriptive being what others do, injunctive, what others approve of. If you click again, and then you could also think about, well, you should be thinking about, right? Who are your reference groups here? Who are the target group that in your social group that you're trying to change their behavior? So in this case, you might want to think about switching out your others in the community to a more targeted group that you're actually trying to change the behavior within. And maybe in this case, it's the unmarried girls in the community. So in that case, you want to be monitoring or developing indicators to think about the proportion of respondents who perceive that unmarried girls in the community are getting tested for HIV. And then, similarly for the injunctive norms, who are the folks whose perceptions are really most important here? And maybe in this case, it's the other members of the congregation. So you would be wanting to find out the proportion of respondents who perceive that other members of their congregation approve of getting tested for HIV. And so note here that there's a distinction, between, in your descriptive norm, you're kind of thinking more about who are the doers, who are the people that you're concerned about doing this behavior most. And then with injunctive, you're concerned most about who are the folks whose approval is most important to changing this norm and then this behavior. And so different groups here: unmarried girls in the community, other members of the congregation. Next slide. Yes, Grace, you have a question? Go ahead.
Yeah, if you can do the other slide, because sometimes the people who are doers and also the ones who approve, they're almost the same.
Yes, they're not always different. Yeah. Mm-hmm.
They're not always different. And so how do you deal with that?
So I think I'm just trying to show that in red here that you just want to think through in your, your monitoring and evaluation plan, and prior to that in your conceptual model, who are the doers that you're most interested in, who are those whose approval is most important, and you would put that into your indicator. right?
Okay.
Yeah. So they could be the same or they could be different. I see a couple of other raised hands. Paul, go ahead.
Thanks, Betsy and Grace. I think that really it is not a problem if the doers and the approvers are more or less homogeneous, but then that helps you in targeting your program. Because the issue is that some of these really could be peers, because peers play a role of doers, but also approvers. So I think what I like about this slide is that it helps us to identify who are the doers and who are the approvers. And if they are the same, then we know how to target our communication campaigns and messages of change. Thank you.
Great. Yes. Good point. Exactly. Exactly. Okay. Was there someone else who had a question? Okay. All right. So next slide. Sorry. Okay. And so then we can use our same, can you click again here? And then click one more time. Okay. So if we have these as our descriptive and our injunctive norms that we're interested in, we also may want to think about what are the outcome expectancies or the rewards or penalties, either penalties or rewards that could happen as a result of engaging in this norm. And so in this case, maybe we, it's the proportion of respondents who think it is very likely that girls in the community will be harassed if they walk in public spaces without a male companion. So this is kind of taking, and this doesn't exactly correspond with the questions above, but again, it's taking that proportion of respondents, then it's the target group, the girls in the community, and then this punishment or reward that could happen for engaging in the behavior. So that's the difference with an outcome expectancy indicator. Okay, great. Next slide. Sorry, okay, so, and then you want to take your, I think we skipped, did we skip a slide? Yeah, so super quickly, so this is an example of a contextual, conceptual framework, right? Where you see on the far side, the individual behavior change that you're trying to, to achieve would be over there. And then in the center here are the things that you, are the norms that you think are affecting these behaviors, right? Descriptive, injunctive, and the outcome expectancies. And then you're going to try to, then there's what people know and feel, and social networks and social support are the other factors that you think that are also affecting your behavior of interest. So if we move to the next slide, then you want to take your conceptual framework and you want to try to put it into a measurement plan. And so then, this is from the ACT framework, which was developed to monitor and evaluate female genital cutting social norms change programs. And then they broke down the different constructs, each of the different constructs. And then for each construct, they have an aggregated measure or indicator. And to draw your attention here, so they have descriptive norms as the social norms construct. And then for that, they're going to look at the change over time and the perceived prevalence of the behavior. And then for the injunctive, they're going to look at change over time in the approval. And then outcome expectancies, they're going to look at change over time in the identification of benefits, as well as intention to give the rewards or benefits related to this behavior. So if we move to the next slide. So as a recap here, we're going to, your social norms measures must refer to a clearly defined reference group, because if you don't do that, right, if you just ask about, perceptions of a behavior, then it's just an individual attitude. You need to ask about it within a clearly defined reference group. It needs to refer to one specific behavior, as I showed in the red brackets, right? One behavior, or else it will be confusing. And it needs to measure either the descriptive, the perceptions of the typical behavior, or the injunctive, the perceptions of what is appropriate. Or ideally, you want to ask about both potentially, not in the same question, but potentially you want to have questions to get at both. And also it's good to understand what those rewards or penalties might be for engaging in this behavior. Yes, and Ben, I'm using the term outcome expectancies. Ben used the term sanctions. Those are both terms that are used in the field, but both refer to rewards or penalties for engaging in this behavior. Okay, so now I think we're going to take a few minutes to do a quick activity. So what I'd like you to, so here are some questions. And I'm going to give you a few minutes to think about how you might change all of these questions, or what are the problems with using these questions as norms change questions. And there's potentially a lot of problems with these different questions in terms of their construction for use in a survey, but let's think about how we could change them, or what the problems are pertaining to these questions getting at social norms specifically. Potentially multiple answers here. So I'm just going to give you maybe like a minute or so, and then you can raise your hand or unmute yourself. I'll ask for volunteers to give me answers for each of these questions. So as you're doing these, I'll just read them aloud to you. So the first question is, do you think most teenagers use emergency contraception? The second question is, of your friends and your religious leaders, how many of them would you say vaccinate their children? The third one is, among girls you look up to, do you think most wear face masks? Number 4 is, do your congregation members approve of Western medicine? Number 5 is, my family members would disapprove if I smoked or drove a red car. And the 6th one is, a woman should not argue with her husband, even if she does not share the same view with him. All right, so do we have any brave volunteers who want to give us some thoughts on the first question? Do people need another minute? If you feel like you need another minute, maybe give me a thumbs up that you need another minute to think about it.
What is the question?
Okay, so the question is, yes. So the question is, I want you to take these here. So let's say you're doing this this is your survey, right? And this is the question that you have on there, but you want to understand this is meant to be a survey to evaluate and monitor social norms. So how might you change these questions to better assess the social norm? So how can we?
Is it okay to start with number 4?
I'm sure. Okay, yeah.
I was when I was reading this, I was wondering in our context here in Uganda, if he said, do your congregation members approve of African medicine instead of Western medicine? And then we would get very interesting answers here as well. Because many of us would say we don't like African medicine until when somebody falls sick, then people approve of the local concoctions and go and use them, like we saw under COVID-19, prevention measures where people went into concocting a number of things.
Yeah, and that's a great point. Exactly. And you get at really well that Western medicine is really vague. Like, what do we mean by that? Right. And then also, I think, we talked about so do your congregation members approve of? So you've got a clear group of who are the approvers, but we don't really have a sense here of who's practicing this, who are we targeting for behavior change here. So that's what I would say is a big problem with this question. Okay, I think
this is Margaret.
Uh-huh.
I wanted to comment on question 1 because
Wonderful.
it does not have a reference group. It's general. It says, do you think most teenagers use emergency contraceptives? But we don't indicate which teenagers. So
Yes,
it's a
yes.
personal attitude. Yeah. So it can't
Exactly.
measure norms.
Perfect, Margaret. Exactly. Most teenagers, where and what setting and what context, and, do they use, I think also, do they use how frequently, et cetera. But yes, where and what setting or context. So get out the social norm, we need to kind of bound that question. Great. How about I see there's some other people with their hands up. Let's see. Grace, would you like to go ahead?
Yeah, I wanted to go ahead and change number 1.
Okay.
Who in this community believe that teenagers use emergency contraceptives? And then I would add there the second one, who in this community approves the use of emergency contraceptives by teenagers, so that I get the 2.
So you get the 2, yeah. So you get the 2, exactly. This is just getting at the descriptive or the behavior, but it doesn't have any sense of the approval. Yes,
Yeah.
great, exactly. How about any volunteers for question number 2?
There is a hand up, Betsy. Madifa.
Madifa, go ahead, please, Madifa.
Whoever is using the, I think it's an acronym, Madifa, not the person's name, but whoever is using the acronym Madifa, your hand is up. Do you have a question?
Did you have a comment?
You probably need to unmute your microphone.
Yeah, if you're speaking, your microphone is muted. Can you unmute yourself? There you go. Hello?
Okay, maybe we can go ahead.
Okay, yeah, well, we're waiting for Madifa to jump in. Does anyone, if we have any other volunteers for question number 2?
Yes, please. I have a comment. This is Brenda. Number 2, I find it to be double targeted. There is of your friends and your religious leaders. So this may collect no specific, some part may get lost in the other. So it's like double barreled.
Exactly. Like who matters here, right? Your friends, your religious leaders. If you have, 90% of your survey respondents say yes to this question, you really don't know what you've found, right? Because, it could be that they're talking just about their friends, or they could be talking just about their religious leaders. So you're mixing your groups here in a way that's not useful, right? Great. How about for question number 3?
We have some people chatting in the box about how they might improve the question. So Judith, do you want us to read yours, or do you want to read what you wrote out loud? Okay. Okay, she said, please read. So Judith said for the first question, similar to what Grace said, that you would say, do people in your community approve of adolescents using contraceptives, or does some other influencer approve, some specific influencer approve of teenagers using emergency contraceptives? For number 1, and then for number 3, she suggested, do your close friends in the community wear a mask?
Yeah, that's so exactly. So for number 3, I think, yeah, close friends could be more useful. I think my concerns with this question might be, you're asking about girls you look up to. I mean, unless you've done a separate survey where you kind of ask about who those girls are, you might not have a sense of those girls. Maybe the girls that the respondent looks up to are girls that they see in social media that don't even live in the community, right? So I think that could be a little bit a little vague and you know, less helpful in terms of, you know, you understanding what's going on in your community. Yeah, similarly, you know, wear a face mask, you might want to, you know, kind of specify that a little bit more to understand that behavior, wear face masks, where, under what circumstances. But I think that's a good suggestion. I see there, let's see, we talked about number 4. I see there's a suggestion in the chat about number 5. Family members is general. I would be specific, dad or mom. That could be helpful. It's true, because again, when you're targeting, you don't understand, you might not understand, maybe some people live in, you know, with a lot of, you know, family members, whereas others live with, you know, just a few. And so you don't really understand who all in the family. Maybe it's just the father who disapproves or whatever. Are there other comments on question number 5?
I think Paul has his hand raised.
Yeah, Paul, go ahead.
Yeah, all these questions are really quite interesting. Question number 5, for example, the challenge I would have with that is that first of all, it does not itemize the family members, because family members are quite heterogeneous. They are not one category, and especially if you are talking of the context of an African family, you need to be a little bit clear, because sometimes when you are among Africans and you even talk about a nuclear family, they think you're a spoiled brat. How can you even imagine a nuclear family? Because that does not make sense in the African context. So I think one might need to be very clear around that, unless you did a study before that and you know what you mean by family anyway. And also, there are many things mixed up. I smoke, then drove red car. So
Oh, Paul, I think we just lost you when you were
Yeah.
about to make a really.
okay.
Yeah, are you there again?
Yes, I'm here. I was saying that if you say, if I smoked or drove a red car, so these are 2 issues in the same question, and people might just reply to one and not the other, and you don't know how to link these answers because there are 2 things in one question.
Exactly. You really need to limit it to just one behavior and be more specific then about which family member. So I think that's great. You got it both. And I think Elizabeth also suggested separating it, exactly, one for smoking and the other for driving a red car. Because if people say yes to this, you're not going to know which behavior they're talking about, right? And then how about finally for question 6? What do we need for question 6 to make this a social norms focused question? Any volunteers? Paul, go ahead.
Sorry if there are others
No,
who might have wanted to say something. I think this is more of an attitude. It is more of an individual attitude rather than a collective norm. So it is an attitude around acceptance or tolerance of violence by an individual rather than a collective norm. It is not referring to the community. It is zeroing down on the individual.
Exactly. So if someone on your survey said they agreed with this statement, that's their personal attitude. But because we have not bounded this in a social space, you know, within a group or community or whatever, then that's just that individual's attitude. And we don't know what we're concerned about with social norms is understanding how people perceive what's going on in the social space. Do you know how many people in your community would agree with the statement that a woman should not argue with her husband, right? Then you understand what's happening at the community level in terms of this belief. But if you just ask this question as is, and it's just an individual attitude. So great, that was helpful. Any final questions or
Betsy, could you talk about how the responses would be captured? The response options to a good social norms question, because Judy said we would have to be cognizant of not using questions that have binary responses only, like a yes or a no.
Yes, that's a great question, Judith. Exactly. And exactly. And because we're trying to, we're trying to monitor these things, and over time we want to know the proportion, kind of, the percent of this happening in the community. So typically these are going to be scaled items, right? So for instance, if we change the question 6, how many people in your community would agree with this statement, we want to get at none, some, most, all. Exactly. Because if we did, yes or no responses, exactly, we don't have that quantity that we want to get at. So with social norms, we're trying to understand over time the quantity of people, that's the social level. So you'd want to do kind of a scaled, typically, response for most of these. Yeah, perfect. Great. Okay, that was great. A lot of really great feedback on all of that from you all. Okay, so let's move on then to thinking about when to monitor and evaluate. Okay, so as with any kind of change, for the most accurate results, you need to measure at multiple time points, right? And at a minimum, you need to measure before and after to see a difference, right? So pre-post, but measuring at multiple time points helps increase the chance that you'll detect a change, right? And in particular for social norms, that to attribute, these processes can be slow, and we're concerned about any kind of backlash that may be happening in the community as well. So that interim monitoring time point is going to be super important, and if you just measure at one time point, if you've measured, during the intervention, if you measured too early, the change may not have happened. If you measure too late, a change may have occurred that goes away. So, you really kind of want to get a sense of, is it continuing, increasing, decreasing, and that, so you want more than one time point to monitor after baseline, if possible. It's important here. If you go to the next slide. Yeah, so, and this is, important because it's generally the case that attitudes change faster than norms. Social processes are often very slow to change. So, as I was saying, you should not necessarily expect to see a very large change in norms over the course of your time frame, but you want to get a sense of the trajectory. So, it's important that, just collecting data at repeated points in time over a longer period of time to the extent possible, but also, as we showed in that previous slide, of all the other things that may be changing in the social sphere, to be collecting information about those other things that could be changing at the same time, and maybe the things that need to change before norms do, like attitudes. So when to monitor is really important to think about in your monitoring and evaluation plan, ideally multiple time points, and ideally over a longer period of time. So next slide. And so for each for each of the different measurement moments that you might think about, there are different methods different things that you are, different purposes that you're trying to achieve, and then different methods that would fit best with that measurement moment, right? So, and this is pretty similar to any kind of research, that when your formative research helps you to identify, right? Helps you to understand the situation. And in this case, it would be particularly useful to help understand how best to talk about social norms that's relevant in that that specific social context, to understand what sanctions exist and what kind of reference groups need to be included. And you could, you know, at your formative stage, you can certainly start with reviewing what literature is out there, having informal discussions, and then maybe doing some exploratory work. And then at your baseline, your purpose then is to verify that those social norms, what's the level of the social norms at baseline, and identify some, you know, opportunities for interventions, potentially places where people seem, you know, what seems to be most amenable to change. So you want to use at this point, maybe some quantitative surveys, qualitative interviews, vignettes, which we'll talk about in a minute. And then over time, you're going to monitor, like I was saying in the previous slide, you want to make sure that you're checking to make sure that there's no backlash going on. And is there any signs of that norm changing or the trends there? So you could use activity monitoring observation. And then at end line, you know, again, assessing for changes in social norms, and obviously the changes then that you're looking for in behavior, and then also looking at the since sometimes attitudes change first, you want to look at whether attitudes have changed. So again, probably using some combination of the surveys and then maybe qualitative interviews or vignettes. So next slide. So yeah, so I thought we could, I'm not sure, Meredith, if we are a little behind here, let's take just a minute here, and I might, yeah, I see Paul has his hand raised, which is great. So I'm going to give the floor to you in a second, but I thought maybe we could discuss really quickly here, you know, maybe you could tell me a little bit about what stage your programs are in and what methods could you or have you incorporated into your programs that reflect these measurement moments. So Paul, yes. Go ahead.
Oh, it is just super exciting, the kind of tools you are providing here. And I see that they are helping to solve some of the challenges we have in our work around
Great.
social norms. So thank you.
Great.
Just one issue about the formative research phase. Could you explain a little bit more the informal conversations or the informal discussions and how those are done, and why you would recommend that they would be the best suited?
Yeah, that's a good question, Paul. I mean, this table, I think I adapted it from another source. I think, you know, so I think often people think about doing the informal discussions at a formative stage, you know, to build kind of stakeholder engagement, to gain entry into communities. And, you know, it depends on what your budget is there in terms of, you know, how much budget you have to actually do more, you know, rigorous recording of data, et cetera. So that's why kind of we're thinking about them as more informal discussions, but really trying to explore things at the community level. I think to the extent possible, I think, you know, I should add to this chart that to the extent possible, it really would be useful to do some exploratory kind of qualitative work where you're, you know, having maybe some focus groups, maybe some IDIs, but maybe focus groups would be better to get some folks involved and really record kind of the way that they're talking about these things, the reference groups that they're talking about. I think that at the end of this session, we're going to advertise for another training that we're going to be offering, which is around the social norms exploration tool, which is a really great tool to use at your formative stage. And it does these different participatory activities with focus groups to help understand, because it's not, formative work is super important for social norms because you can't just walk into a community. These are unwritten, so you can't just walk into a community and ask people what the social norms are. So you need to kind of explore, and through participatory things, you can start to understand what exists there, the terms that people use, and who's involved in these social norms. So informal discussions with community is one way, if possible, maybe some more formal exploratory methods like the social norms exploration tool. Great. Does anyone have if you go to a comment to make maybe, or something to to discuss, to link this to maybe what stage your programs are in or what methods you could have or have used in your programs? Do these methods all look Pretty similar? Anything different that you're noting here? I mean, Paul's point was useful. Paul's question was useful. Okay, great. Well, since I think we're running a little behind, we'll move on, but there'll be some more opportunities for you all to jump in with your questions and comments as we move through this. Okay, so now let's talk a little bit about how to monitor and evaluate changes in social norms. So this slide, I would just say briefly, I don't want to confuse things here, but these are just some broad categories to approaches to monitoring and evaluation for behavior change programs. And these can be applied to monitoring and evaluating changes in social norms over time. But, you know, there are pros and cons of using these different evaluation designs, but each can be utilized for social norms change with, you know, an addition of those of our social norms change, you know, measures or monitoring techniques. So it depends on your, you know, program's budget, timeline, etc. So in today's discussion, we'll focus on what is unique for how to monitor and evaluate social norms, which largely has to do with how we measure these tricky unwritten rules, right? How to ask about them in qualitative discussions, but this is just to show that, you know, you can incorporate social norms measures and into any of these different M&E approaches. So you're not limited because you're trying to do a norms change program. Okay, so the next slide. So how to measure normative factors for M&E. So many tools and formats exist to help you quantify perceived norms, including single item questions, indices or scales, and vignettes. And these, we'll first talk about vignettes in the context of you can put them into your quantitative questionnaire. So we'll review some examples of these different approaches. So next slide. So single item survey questions, we kind of already covered that a bit in our what, right? So you, again, this is your formula for thinking about, you know, what proportion of, you know, the others in your community, the reference group that's important, do you think engage in this behavior? And then adjunctive norms, and same thing, to what extent the reference, you know, the reference group approves of this behavior. Okay, next slide. So you can also use single item questions for understanding sanctions. And this is an example from a study, Parvatan study done in India. The question asked about if you're, you know, for girls, if you're given more freedom to move about in public spaces and play sport, how likely is it that the following consequences might occur? And then they ask about 4 specific things: being harassed by local boys or men, encountering more arguments or conflicts with your parents, finding it more difficult to get married, or being considered uppity and disobedient. And for each of these, there was a scale score from very likely to not likely. So you can incorporate those kinds of questions into your survey. Next question. Next slide, rather. So the reference groups, how you get at reference groups, there are a number of different ways that you can do this. We've shown so far how we embed the reference groups into the questions, but, you know, one of the concerns that I have with a lot of those measures is that, you know, we first either need to do that formative work to really make sure we understand who are the specific reference groups that matter to that behavior, or we need to, you know, to ask about that further on our survey. And so this is an example from a survey that was done in the DRC and in Nigeria, right? And they wanted to know about family planning behaviors. So they asked, you know, a reference group elicitation question first, right? So they asked, you know, people to tell us, they gave a whole checklist of these 11, 12 different categories of whose opinion is important to you around these behaviors. So this is to help target who are the reference groups that really matter. And then they asked a separate question about power holders. right? So sometimes the people who influence an individual's behavior, whose opinion is important, or whose support is important, may be different than who holds power in the community. So the question, if you wanted to use this, would you need anyone's permission? Okay. So another way to do this, so there's that question, which gives a list, and they think about in ahead of time who are the reference groups that might matter, and you put that list onto your survey, and you have people check which of the reference groups they think are important in relation to that behavior. Or you could do a separate network, egocentric network elicitation within your survey, where you get people to talk about who are all the people in their egocentric network that give that that they interact with in different ways, and then you can find out about the behaviors and who's supporting behaviors or norms within that egocentric network. So this is from a survey that was done, and I'm not going to, I always pronounce the project wrong, but it was I believe done in Mali. And so they first asked, so what is, so they asked a general elicitation, egocentric elicitation question, so now we're going to talk about the people in your network, people who you interact with, people who you receive support from, people you consider to be part of your world. People you mentioned can live in this village or elsewhere. So their decision here was to not contain it to within the village, to have it, in the village or elsewhere. But then as you see over here, they're going to record the names on the grid, and then later they're going to, they come back to finding out a residence of each of those individuals. So they start out with saying, what is your relationship with each once you get all the names on the list, let's say in this case, I think they limited it to, I think this is 10 names, right? Then you want to go back and ask about the relationship with each of these people. You want to find out where this person lives, whether they're not in the same household. And then you get to how it relates to your behavior of interest. So have you spoken with the person about this behavior of interest? And would you say this person approves? And would you say this person does this behavior? Do they use a method of family planning to space their burrs? So this gives a more individualized, I guess, a sense of, who are the individual reference groups and who are the approvers and doers and, of these behaviors for the descriptive and injunctive norms. So this is a nice, I like this method in the sense that we're not making any assumptions about who the reference groups or who the power holders are, or the people who matter. But on the other hand, this does take longer to do, right? Because you need to do this first, list all these names, find out about the relationships, and then find out about the approvals and the doing. But it is nice for not making assumptions. Okay, next slide. So then, of course, for your monitoring and evaluation plan, this is just to remind us that we need to take all of our survey questions, right? And then we need to figure out how we're going to score them, and then develop that indicator that we're going to follow over time. So this is from that ACT framework that I showed you earlier, right? That was focused on female genital cutting. So they had some questions, that were, and again, these were scaled questions because we want to look at these trends over time and the proportions. So they had questions about using a scale of 0 to 10, where 0 is none, 10 is all, about how many girls in your community are currently cut. And they had 3 questions with the 0 to 10 scale. So then they scored them, they averaged all the scores. And then over time, they looked at changes in that. And this was, since they asked, perceptions of people doing it, this is the perceived prevalence of that behavior. So this is our descriptive norm. And then for the injunctive norm, they, again, here they're focusing on who they think is the approvers, or the people who matter to this behavior, the reference groups who matter to this behavior. So this was immediate family, extended family, friends and peers, community, and people whose opinions are important. They asked about all those different bounded groups, right? And then they decided in this case that for scoring that they wanted to know the percent in these groups who respond abandoned. So they had a scale. It doesn't show the scale here, but oh yeah, continue or abandon. So they had to have all abandoned, right? And they looked at over time the percent of the folks who perceive that they're from all of their groups the social expectations to abandon this behavior. So again, just this idea of taking your survey measure, then rolling it up, looking at how you're going to score it and what kind of cutoff you're looking for, or trend you want to look for, and then tracking that over time and the differences for the descriptive and the injunctive in terms of how you bound it. Okay, next slide. And so this is from this is from a survey that was done on menstrual hygiene in India. And this is just to say that one thing that can be interesting to track over time, we talked about how sometimes attitudes change before the social norms do. So in this case, they asked about the respondents' attitudes about the behavior, and then the respondents' perceptions of what others approved or disapproved of, right? So here they asked about, I want to understand the levels of approval or disapproval. Can you tell me to what extent you and other girls like you in your village approve or disapprove of the following? Right, so the reference group that they thought was important here was other girls in the village like yourself. So the first question is, do you approve? And then the second question is, do other girls in your village approve or disapprove? And so that's kind of can be a useful question for tracking how are the attitudes changing alongside how are the norms changing.
Should we stop for questions?
Yeah, I think this
we
is a good
go
time
on?
to stop. Yeah, exactly. Perfect. Are there any questions? Any questions so far on what I've presented? Paul, go ahead.
Betsy, it is interesting. The first, the slide on the social network analysis. Was it social network analysis that you had?
Yes.
The one that had a chart and then people would fill in.
Yes.
What is the correct name?
Well, so yeah, so exactly. I throw out these terminology. Egocentric network. Go ahead.
Yeah. So that I found it useful. One time I applied it. I'd gone to the western side of, actually I'd gone to Fort Potro to Professor Vantevia's village. And then I was, doing work, and I found that the program, through that methodology, we were able to realize that the program was targeting people as reference groups, but which the community did not identify at all as reference groups. So using that methodology, we were able actually to advise one of the NGOs to change whom they were considering as a reference group. So I find that method, although it is quite cumbersome, but very helpful in identifying the right reference groups.
That's fantastic. That's great, Paul. That's great to hear. Exactly. That's why I like it. Exactly. You're not making any assumptions. You're not going into this saying, I know who the reference groups are, so I'm going to go ahead and ask about them in the questions. You start out by asking, who is important to you, exactly. But then of course it does take a little bit, it's a little bit more complicated on the analysis side, because you have to then look across at all these people and to see who they're identifying as the reference groups. And, and then, like you said, then to assess, are they the reference groups that we thought were at play is super interesting. But yeah, a little more time consuming, but useful. Yeah. Great. Any other comments or thoughts on what I've presented so far about the survey questions and getting at reference groups, tracking attitudes? And yeah, if any of you have any experience using any of these methods, feel free to jump in. I'm enjoying hearing about like that Paul's used this method and how it worked out for him, that kind of thing. So great. All right. Please don't be shy. I'm happy to take any kinds of questions. So feel free to raise your hands throughout, and I'm trying to keep an eye on the raised hands in the chat box. So feel free to jump in. I guess we can go ahead to the next slide. All right, I'm just going to spend a quick moment on this. I don't want to confuse things too much, but I did want to, I think a term that we see a lot out there is collective norms. And I just wanted to make a distinction that when we ask on these questions, we ask individuals what they think others do or what they think others think they should do, that is an individual's perceptions of what exists at the societal or group level. But when we talk about collective norms, typically we're talking then about the total of everyone in that survey and what they thought. So it's the total of the perceptions of every individual in the population. So you would take, if Alice is one of your survey respondents, you take Alice's responses and, Paul's and Grace's, et cetera, and you add them all together. So if you go to the next slide. So again, collective norms, when we use this term, just so that you understand what it refers to, it's talking about the sum total of a type of behavior or a social norm in a bounded social space. And yeah, so we typically we're aggregating these individual level behaviors or attitudes calculated as the sum of the reports of the behavior or the norm or whatever within that space, around the social space. I think one of the things that's tricky about this is, and why I just want you to be aware of it, but not to worry too much about it, but it's tricky because we have to think a lot then about how we're bounding that social space. Like, are we saying this is the sum total of people who live in a geographical area, or is it the sum total of responses for girls of a certain age, or is it the sum total of responses of people who are a certain religion or who live in a certain district, right? So it can get quite tricky. So I just want you to be, aware of the term, but it would take some additional level of training, I think, if you wanted to actually to use collective measures. If you go to the next slide, this is just a slide to illustrate this, what you can see across these different graphs here. So this is from a study that estimated the effects of nonconformity to gender norms, positive, negative differences, the bars going on the right side or the left side, between individual estimated and the median for same-sex school peers, so the collective norm. And what I wanted to just draw your attention to here is that there's bounding here by gender, age range, geography, and activity, in school here. So so not to confuse the picture, but that's just to give you some sense. So you could what collective norms are and how we sometimes compare them then to individual measures. Okay, so let's move on because that's a little complicated. Okay, so getting back to how we're going to monitor and evaluate for social norms. So scales and indices are very useful here because social norms are, as we've seen, they're a phenomenon with lots of different dimensions. So that's not directly measurable with a single question. So you're going to need more than one question. And so if you ask a bunch of your questions with scaled responses, you can put those all together and you can do a simple sum, which is an index, or you can go one step further and develop a scale. And a scale is basically an index, but then it uses these different statistical techniques to ensure that all the items in the scale are related to each other. So scale, you know, generally speaking, the term scales and indices is talking about pulling a bunch of different questions together, summing them to create a score. So if you go to the next slide, this is just, you know, again, to say that if you're going to put them all together into a scale, there are additional trainings and, you know, and guidance on how to do that. And it's a lot of different steps are involved. So this is guidance from UCSD about the 10 steps that you need to take to take your individual measures and put them all together into a valid scale for measurement. So just a word of caution about just deciding to put a bunch of measures together, you know, and call them a scale. You could do a simple average and call them an index, but be careful about when you want to put something together as a valid scale. You have a lot of different steps you need to follow. So the next question, though, shows the next slide rather, shows that you can put different questions together as an index. So again, from the ACT framework, these are, you know, 8 different questions about injunctive norms and for descriptive and injunctive norms. And then they, you know, they created this index where they put them all together. So there's a score that ranges from 0 to 35. Then when you put them all together, where the higher score indicates social norms that are more supportive, lower score, less supportive, right? And then you can get a sense of this overall index, or, you know, over time, how that's changing. So simple sum. All right, so let's talk about vignettes. So vignettes, I don't know if you all know how to use the, could you all, any chance we could do a raise of hands quickly to let me know how many of you are familiar with vignettes? I'm just curious. Can you use your raise hand function if you're familiar with vignettes or have used them before? All right, so I'm seeing one hand, so not very, 2 hands. Okay, great. So not as much familiarity. They're kind of a little bit the new kid on the block, but they are becoming really popular for use for measurement of social norms because they're this guided storytelling methodology that can be conducted with an individual or a group. They can be communicated to respondents in many ways. They can be done qualitatively or quantitatively by developing response categories to the scenarios. And there's no firm rules about the length of the complexity, but you just simply want to try to get a story that's, you know, that's simple, that's relatable, and that's precise. It provides a sufficient detail that participants, you know, can't fill it in with their own ideas, but and they have several advantages because if the scenarios are relatable, they may be more realistic and less abstract way of thinking about social norms. And they minimize social desirability responding because the questions are typically not about the respondent, but about someone like them. So there's a character that they're following in the story. So next slide. So similar to, as we were just seeing with how to construct social norms survey items, there is kind of a formula for constructing a vignette. And in this case, you want to be thinking about, you know, what is the behavior of interest for your story? And then you want to be thinking about questions to explore the perceptions about the common behavior, the descriptive norm, and questions to explore about whether others approve this behavior or the injunctive norm. So you're first going to think through, you know, the behavior of interest. So in this, you know, maybe it's in this case, body changes, menstruation. Then you'd be thinking about, okay, well, what are typical situations when discussions about this might occur? What goes on in these situations? Who might be typically be involved? And then you go along evolving your story. So I think the best way to explain these is to show the next slide, which is the sample vignette. So this is from the Abidaburu project that was done in Ethiopia. And they developed, this was some stories about, this was a project focusing on child marriage. So they developed a central character, Rahima. She was a 16-year-old student who lives with their parents. And so the vignette would, you know, set the stage for folks and say, you know, I want to tell you a story about Rahima. She's a 16-year-old student who lives with her parents. She attends school and she helps her mother with household chores. One day, Hindaya, Rahima's cousin, comes over to visit Rahima's family. They are about the same age. Hindaya announces that she's getting engaged, getting married in a month's time. She also strongly suggests to Rahima that she should also marry soon as she's getting old for marriage. Hindaya reveals that she also knows someone from their village who's interested in marrying Rahima. And then they stop and they say, okay, so now what do you think most adolescent girls in Rahima's position do in this situation? And what would Hindaya and most other girls expect Rahima to do in this situation? All right, and then there's a discussion. And then then you can go on to say, to counterpose a different, you know, a different kind of situation. You say, okay, but what if Rahima doesn't want to marry young? She announces that she does not want to marry at this age. What would happen? You know, what are the sanctions or rewards? What would Hindaya or most other girls say about this? Would the opinions or reactions of her peers make her change her mind? So how strong are the social norms for her? And are there any circumstances where it would be considered more or less acceptable for her not to get married at her age? So it really gets the participant to be thinking about the situation and be less inhibited about talking about it, because it's not asking specifically about them, but it's a character that they can relate to and a situation that they can, you know, hopefully relate to, right? That would happen in their situation. So if you go to the next slide. So what was super interesting about, you know, this project is they got a lot of really rich responses that helped them to understand the descriptive norms, injunctive norms, sanctions, the severity of those sanctions and the exceptions, right? So these are example responses. One respondent said, you know, father and mother make every decision about the marriage. It is not acceptable that one should marry on her own wish. So it tells us that in this social context, this is not an acceptable behavior, and that father and mother are the real decision makers here. So that's really useful, right? Again, with the injunctive norms, some respondents said parents make this decision in order to avoid any bad rumor in the society concerning the girl. So this is kind of the negative things that would happen to a girl if she were to engage in this behavior. Her mother tells her that if she does not follow her own wishes, the neighbors would backbite about her and would laugh at her. Again, the sanctions that would occur to the girl if she goes against the social norm. And although a girl has grown enough and is eligible for marriage, and she says she does not want to marry, then we order her to stay inside and also order her not to move anywhere outside. So these can be pretty severe sanctions in this social context if she goes against the social norm. So this is really useful information. And then, but then we also find out, one respondent said some girls do reject marriage proposals. For example, if the groom side comes to see the girl and the girl doesn't like him, she can reject the proposal. So there does seem to be, you know, some exceptions here. So this gives us, you know, some insight into maybe some of these norms could change. And so we might want to explore that more and find out what are the situations where these exceptions are made, right? So any questions at this point about vignettes? We're going to do a little group activity, but before we get to that, do we have any questions from anyone about vignettes? I think I saw, what, 3 hands raised for folks who had used them. Has anyone who's used them have any comments about how well they worked or didn't work, or what you liked about them, or what you use them for, or anything like that, to give us some context of their use? No, we have a quiet group here this morning. Okay, well, no problem. So I'm hoping you're going to get a little more active and involved now, because we're going to do a little bit of.
Hi.
Yes, great,
Hi,
Paul.
Betsy.
Hi, Paul.
I was trying not to speak, but I think the challenge with vignettes is choosing the right vignettes and taking some time to pretest the vignettes to make sure that they resonate with the needs, with the contexts, and also put them in a language such that your respondents or study participants can relate to them. So making sure they are relatable too. Otherwise, I find them to be extremely fascinating, and I'm glad that you have introduced them today. Thank you.
Yeah, I think that's a great point, Paul. And I just in general, thank you for all your great comments and suggestions, and adding to the conversation about your experiences. It enriches the conversation for sure. And yeah, that's the thing. I really like vignettes because they, you know, they lessen that burden on the respondent to tell about him or herself. They can kind of be a little bit more engaging and fun. There's a story, you know, I get to relate to it. But I agree with you that they really take some time. You got to make sure that your characters and your scenario are really believable. They're told in the you know, with the terms, et cetera, that folks really to say, oh yeah, that happens in my community. Oh yeah, you know, and they can really, and if you don't give enough, you know, of a scenario, they could start filling in the, you know, the details themselves. Or if you give them a character that they don't relate to, they could be like, well, that, you know, I don't know what you're talking about, that never happens, kind of thing. So they take some time to develop for sure. So I think worth it in the end, but you need to be able to invest that kind of time to develop them appropriately. Great. Okay, so I think from there we're going to go into a little bit of we're going to go into some breakout rooms and kind of discuss, do a little exercise and have some discussions together. I think Meredith, once I explain everything, she'll move us all into these breakout rooms. And I think, how much time are we going to have for the discussion, Meredith, if we want to come back together at the end?
How much what's the minimum amount of time you want to reserve when you come back? Because we have 20 minutes left in the training.
I mean, I probably ideally more than 5 minutes, somewhere between 5 and 10, I guess would be good. I don't know.
Okay. Should we just go into the breakouts for 10 minutes? Is that enough time? Or
Yeah,
should we?
that should be okay.
Okay.
Okay, great. So we'll go into the breakout groups for about 10 minutes. And I'm gonna try to have you think about a hypothetical case study. So we go to the next slide. So so in this hypothetical example, there is a program called Healthy Homes. And again, we made all this up, but let's say there's a program, Healthy Homes, and Healthy Homes is trying to get people, the behavioral outcome here for this program is to get people to use improved latrines. And Healthy Homes is building off, you see here the conceptual model for Healthy Homes. They're building off another program that's in these communities called Latrines Are Us. And this program is just going in and building these new and improved latrines. And so they're building off of that, the ability of the new latrines in these communities. And then the Healthy Homes Project in particular is trying to change personal attitudes by using a mass media campaign with radio ads and billboards, you know, with, no, yes, use a new latrine. And then they're also using health workers in some communities to help, you know, and they're using community health workers, I guess, in all the communities to get people to understand the benefits of latrine use. And so they're hypothesizing, this is a norms change program, they're hypothesizing that with these three components, availability, change in attitudes, and change in benefits, they'll be able to move the norms around positive use of latrines, perceptions of positive norms, perceptions of, yeah, latrine use, positive norms around that, and that will in turn change the behavioral outcome. And so if you go to the next slide. So they did some initial data collection, call this formative, maybe this was just before baseline, whatever. They did, this is what they know at outset. They know about the use of latrines in the past 24 hours, the perceptions that community members use them, the benefits, and the whether folks have an improved latrine available at home across these 3 communities. And so I'm going to have you all get into these groups and discuss for about 10 minutes, what factors, if you quickly look at this data, what factors seem to be affecting latrine use? Do these factors seem similar or different? And then based on these similarity or differences, what, if any, additional data might you want to collect in your M&E plan? So I'm trying to get us to think about our M&E plan, and would you change any of these indicators? And so as a hint here, I want us to be thinking about what we talked about are the components of the questions you want to ask around norms, and then the other things in the social environment that might be changing that you might want to monitor. So okay, with that, are there any questions before we get into the breakout groups? And we can leave these questions up.
I think, Betsy, I might suggest, just in the interest of time, if we stay together. Is that okay?
Yeah, that makes sense, actually, given we have very little time to go into. Yep, that totally makes
Okay.
sense. It totally makes sense.
Yeah, so why don't we give people like 2 minutes just of quiet, just to kind of look at the data, look at the questions, and then we'll open it up.
Great. And yeah, again, please don't be shy. There's no right answers here. There's a lot of different things that could come out in this discussion. I'm interested in hearing your thoughts and just getting us to think about how we take some of what I presented and think about how to put that into a monitoring and evaluation plan.
Betsy, the words under the graph are not clear. Is there a way in which you could make this a little bit bigger, the diagram a bit bigger? Maybe, is it in full screen?
I think it is. Camille, I don't know if there's a way you could make it bigger. I don't know.
The ones on the left are okay, but the words that are under the graph,
yeah, the words under the graph,
visible.
Yeah.
I'm not sure I can do that on my side, but maybe we could read them out from left to right, the blue, orange, and gray.
Yeah, I think so.
So the blue is community A, the orange is community B, and the gray is community C.
Okay, so they're just the communities. There's no additional information to that.
So there are the communities, and then the 4 things that they have data on are the percentages that used an improved latrine in the past 24 hours. That's the first set of bars. And then the next is the percent of folks who think that most community members use an improved latrine. This is the next set of bars. The third set of bars are those benefits of an improved latrine. And the last set of bars are the in each community, the percent of the community that has an improved latrine available at home. But that's all that's all the information that we have, hypothetically speaking, at the outset here of our program. So based on this, what do we see, and what do we, what additional data might we want, or what indicators might we change? So does anyone have a response for the first question? What for the first set of questions, I guess. The first set of questions is just kind of orienting us to this data. What factors seem to be affecting latrine use? And are these factors similar across communities or different? And since you all are shy, and since I want to get to the questions about the M&E plan, I'll just cut to the chase here and give you my thoughts on what I was trying to show here. You know, it's just that they're pretty, what's low here is the behavioral outcome is still low, but the norm, what's also interesting, if you look at this first two set of bars, right, is that the in the community B, which is the orange one where the bar is highest, there's also the highest percentage of people that think that most community members use an improved latrine. So this tells us something that maybe that norms maybe are at play here, right, in terms of using an improved latrine, right? Because in the other two communities, the norms are pretty low and the use is pretty low, right? And the benefits, knowing the benefits ranges across the communities, and the communities have kind of similar levels of improved latrine available at home. So based on that, I would really love a few thoughts from all of you on what additional data, and a lot of different possible answers, what additional data might we want to collect, and what might we, you know, in terms of indicators going forward in this. No wrong answers, don't be shy. Thinking about some of the stuff that we talked about today in terms of what we want to monitor for social norms change.
Yeah. I think what I don't see here sanctions.
Yes.
Or rewards. One might want to collect some data around that. And it is not clear if there is anything around the key influencers.
Exactly.
I don't seem to see the reference group here. Yeah.
Anything else that folks notice is kind of missing or that we might want to track? Don't be shy.
Is there anything that you would do in your monitoring to address how big the discrepancies are between villages, or would you still, or would that not affect your plan at all because you'd be using like uniform tools across the villages?
I think you would probably still use, yeah, uniform tools across the villages, but it may tell you something about, you know, the way that you want to target some of your activities. But I think that, you know, Paul made a really good point, which I was exactly hoping that would come out here, is we don't know anything about who we need to target in these communities. Who are the reference groups? We don't know about the sanctions. We also, you remember the conceptual model here was that individual attitudes were in this, in the pathway to change, and we don't know anything about individual attitudes, so we'd want to put that in as a something that we would want to track over time. You know, we are tracking here, we have some information here about the descriptive norms, but we haven't asked about the injunctive norms, right? That the perceptions that people approve of using an approved latrine. So, and then, you know, yeah, we don't know, maybe we want to, you know, thinking back to the one of those first slides about other things that are happening in the community, you know, we might want to understand whether people are talking about this with each other and how much that's happening over time. Because some of these other things may be indicators of change before actually getting our final outcome of used and approved latrine in the past 24 hours. Does that make sense? I know that this is a lot of material in a short amount of time. Has any of you tried to monitor or use any indicators for looking at social norms in any of your programs? Shy group. Okay. Well, I am, yeah, feel free to use the chat box. Absolutely. If you have thoughts that you, but you're having difficulty with your microphone or would rather just put it in the chat box, please do so. But this activity, and I think maybe in small breakout groups, we might have been a little bit less inhibited to chat openly about this. But this is just to say that there's, a lot of additional things we might need to be looking at over time to really get a handle on this. But it does seem like, norms, thinking that most people use and improve latrine is an important factor here in changing the dial. So. All right, so I guess in the interest of time here, I will move on to my last couple of slides. I wanted to encourage you that there's a lot of additional resources for reading more about how to measure and monitor social norms, and a lot of good tools out there. There's a practical guide for program implementers on measuring social norms. There's the CARE tipping point monitoring and evaluation tool, the ACT framework, which I presented quite a bit of today. There's UNICEF has a couple of good resources. And then there's this map of social norms focused projects, which I would encourage you to go to if you click on the next slide. This is a screenshot. So this is a map that is part of the Global Learning Collaborative that we developed. And it's housed on the ODI Align Advancing Learning in Gender Norms web page. And the link is in the previous slide. But if you go to the map, what's nice about this map is you can say, okay, I want to do a project on social norms, and I'm going to do it in Nigeria. And so then you click on Nigeria and you find out what other projects are doing work on social norms in Nigeria. And if you click, you can zoom in on the map anywhere on the map in the world that you might be wanting to do your work and find out what else is happening there. You can also find out then when you click on that specific country, you can find out about a specific project and then go into, and there are these summaries of the different projects, where they were done, what kind of data they collected, what organizations were involved, what kind of social norms they looked at. You can also, on the side of the map, you can search by, if you're interested specifically in gender-based violence, you can search on that and find out what social norms programs have done work on that anywhere in the world, or you can find out which programs have done work on, childhood immunization and anywhere in the world. And you can also search by data collection methodology, key terms, etc. So it's a really useful map. Now there's about 100 different, there are 100, I believe, different projects that are on the map. And the other thing I'd like to say about this is we encourage you to share your work. We're always looking for new additions to the map to continue to fill it out and showcase everyone's work in this area, learn from each other. Okay. So as I alluded to earlier in this training, coming in May, we're going to offer another training on the social norms exploration tool. So the social norms exploration tool is a really great tool. It's a participatory learning and rapid assessment tool to gather information at the community level, helps program staff develop an understanding of the social norm that influences how people act or behave, provides you and your staff with actionable guidance and exercises. There's a lot of different exercises in this. You can customize it to your needs. I just did a study in Burundi where I pulled different pieces from the social norms exploration tool to use. So I really encourage you to join this training, and the training will be for both members of the Nigeria and the East Africa Learning Collaborative. And after the training, folks will roll out the SNET with their teams and projects, and we can hold regular check-ins to share experiences. So that'll be a really great opportunity. And I think some folks are chatting here about SNAP. Maybe there's some people that have used it. Has a community mobilization tool that has worked well, and social norms change for the UGA net, balancing
I
power between
think
men and women.
they're
Great.
referring to this, their chat above. So Bob Watira said, has any institution worked with the SASA methodology?
Okay, I see. Yeah, it relates to that. Thanks for catching that. I see. Oh, great. The SASA methodology. Okay, cool.
If you could share a link with or any information with us, that would be great.
Yeah, I would love to know more about that. I know SASA, but I would love to know more yeah, about their community mobilization tool specifically. That would be great. So here is embedded a link to view the full social norms exploration tool. It kind of takes you through these 5 phases of planning and preparing, identifying the reference groups, exploring the social norms, and then also walks you through analyzing and applying your findings. So it's a really useful tool. So dates in May are still to be determined, but we hope that you will join us. You can take a look in advance at the tool and come prepared with questions and yeah, so I think that is all we have for today, but I'm happy to answer any final questions. I know this has been a lot of material, so you can also get in touch with us with any questions you might have. Meredith, do you have any important closing remarks? Or maybe Grace or
I just got a question from Alim that was asking how they can add their work to the map, and I think I don't know if the link is still on that page, but I'll just put my email in the chat box so that I can help people navigate getting their case studies added to that map.
That would be great. And that is a great question about adding your stuff. Exactly. I know that we over time have been working to develop more functionality to eventually to the point where people can kind of go in and there's a form. I believe now there's a form where you click somewhere. There's a form that walks you through how to fill out about your program, what information we need, and then you submit it. And so I think it's on the map. It's a good question.
Yeah, they're about to relaunch the map.
Relaunch it, yeah.
And it should actually be happening in the next month, like by the end. It might even be within the next couple weeks. So they just improved the functionality of the map, and then I think that's when it'll be easier to submit your case study. But in the meantime, you can just email me at my email that's in the chat, and I can help you with the form. So it's really straightforward. It just asks some basic information, but what's so cool about the case studies is that the tools are on there also, so you can actually see people's measurement tools.
Oh yes, I have neglected to say that. Exactly. So you go in and you click exactly on the project on the map, and then if you go all the way down to the bottom, there are links to the different tools or surveys or activities or whatever that they did. Not for all of the projects, but for the vast majority, and that's a really great resource. So that you don't need to recreate the wheel. You can take a look at what other people have done and draw from that and learn from that. And yes, we encourage you to put your projects up there. So. So get in touch with us about that. Be great.
Great. Thank you so much. I think we've gone over time, so we won't keep you any longer. I don't know if Madanda or Natalie or Grace or Paul wanted to say anything as a closing comment.
I'll just say thank you everyone for attending, and because today crowns the last of the series, I don't know, Meredith, if we have any planned in the pipeline, but if we do, I guess we shall communicate at that time. So just to say thank you to everybody for their participation. And I guess Grace or Madanda will probably say something as well.
Yeah, we'll follow up with the date for the SNET for this training on the social norms exploration tool. So that's our next training coming up.
Maybe I'll go first, maybe, and then say that we thank you all very much for the training. This was, quite informative. A lot of things to process, but very nice exposure to many of us. I'm sure many of the participants will agree with me that this series have been very, very informative. We're looking forward to an early announcement of the date for the SNAP training in May. We're looking at people that we think should be in this training, especially our people at the forefront of monitoring evaluation, to be able to help us develop and the tools and the whole meal system around social norms programming, which by no means is growing, or even we have been doing it without naming it as such. So as we refine it, as we move forward, we need to really measure it very well so that we can do a good job, because we know that gender and social norms, sticky ones, are the ones which have been challenging our gender equality work for a very long time. So until we pinpoint this, we'll probably be moving in circles. So we look forward to this training and learning more. For me, I've seen, that there are more resources than I thought, and probably even others. But of course, they are not yet saturated. So thank you very much. I don't know whether Grace is going to add her voice. Otherwise, we've overshot on the time, but I will let her say it herself. From me, thank you very much. And the CARE fraternity, we continue to work together on this. Grace, do you have anything to say?
And from me, I just say thank you very much. This has been, super good, and this really has strengthened our community and the members who have attended. These are some of the things that we just didn't really have in our hands, and now we have this, and we look forward to really even work with you further. Even if it's not in the training, we can always contact you and ask you. And also, we are actually on your mailing list now to be on any incoming training of social norms. So we are really excited, and we are happy. We've just learned a lot of things, and our members, if they were all allowed to talk, they would definitely be thankful. Thank you, ladies and the team, for actually bringing up this, and all our facilitators. You have been super good. Thank you very much. We look forward to further collaboration and working with you. And we really pray and hope that, which I believe will happen, that we definitely implement some of these and work with some of these tools that we are working with. And I think me and Paul, we can confirm that what we have learned here is going to be applied on our project, which is examining the social norms on unpaid care. A consortium of CARE Uganda and the CARE International Uganda, Makerere University, and the Economic Policy Research Center. We have a 3-year project dealing with norms, and so social norms on unpaid care. So we're definitely going to use this information and the packages that we have learned. Once again, thank you so much, and have a good day, everybody.